Hello, fellow nurses. Are you interested in getting away from the bedside and getting into something like nursing informatics? I've been a nurse informaticist for over 10 years, and I've worked in the different areas of nursing informatics. I've worked on the clinical side and I've worked on the IT side. I've also been a preceptor for nursing informatics students for many, many years. So in this video, I'll talk about what is nursing informatics, how I got into it, how are some ways that you could get into it if you're interested. A lot of people think they have to have a degree, and you don't. Many people I work with don't have a degree. I'll talk about the benefits of getting into nursing informatics, and I'll talk about all the different career opportunities out there for that field. So you may be asking, what is nursing informatics? And I'm going to try and explain that in simple words. To me, it's simply being a liaison between the clinical staff and patient care technology. And many times that's designing, training, and implementing the electronic health record, the charting system that the hospital uses. It could be something like working with nurses to develop their documentation, like working on electronic forms or electronic flow sheets. It could look like working with providers to develop their order sets. It could look like training nursing on barcode medication scanning. It could look like many things, but essentially you are the liaison between the end users and technology. The government, Medicaid, and Medicare will not reimburse hospitals until they've reached a certain level of that technology. So because of that and the many benefits of patient care technology, the nursing informatics field has really, really grown. So how I got into the nursing informatics field was after I graduated with my BSN, I took a year off and just worked at the bedside. And then about a year after that, I enrolled in the nursing informatics program at my university, got accepted, started taking some classes. The good thing about the classes were they were all online. I worked night shift, so I needed something flexible, and this was pretty flexible. I would say the least flexible part is the practicum. So in your last semester or your last 2 semesters, you have to do a practicum, clinicals, in a nursing informatics department. I did mine in person, and I had to do many, many hours. But I'll tell you, lately, ever since COVID, my students have been doing their practicum with me on Zoom. So it's actually a little bit more flexible now than it used to be. And while I was doing my practicum, I was working in a nursing informatics department. They liked me. They had some job openings come available, and I applied, and I got the job. And at that time, I was helping out with training with BCMA, barcode medication administration. And I was also working with patient care technicians with their new Dynamaps, getting their vitals to go into the chart. I was working with nursing and getting their forms and their flow sheets developed, and working with providers on getting new order sets made. So my first job in the field was more of a clinical liaison. I wasn't doing the IT stuff. So I wasn't doing the coding. I wasn't doing the actual building and working with the software, but I was more of a liaison working with the end users to design what they wanted. And then I would take that design and give it to the IT people. But 6 years ago, I started working on the IT side of things, where I take the design from the nursing informatics department and I actually build it into the EHR. So for many hospitals, there's the clinical liaison side where you're working pretty closely with the end users, but then there's also the IT side where you're a little bit more removed from the end users, and you work more with the liaisons like nursing informatics, pharmacy informatics, medical informatics. So I say all that to say, depending on your interests, you may want to be more on the clinical liaison side, where you want to still be really, really active with nursing and end users. Or you might be kind of tired of that and you want to do something more computer geek oriented, like an analyst that would code the changes. Both have their advantages and both really benefit from having a nurse with nursing background doing the job. Now you may be asking, Chris, what's the best way that I can get into this field? And I would say, as a bedside nurse, start being a super user as soon as you can. Be a super user. Sign up for when people are asking for super users to kind of help implement and train on the new technology. Go ahead and sign up for those kinds of opportunities. Many hospitals have like an informatics council or a patient council or some kind of council where you can be active in making decisions about patient care technology for your hospital. Get on those kinds of committees, get on those kinds of teams, because you're going to make yourself visible, you're going to get your face out there, and when you do apply for a job, they're going to already know you. And I'll tell you this, don't worry if you don't have a nursing informatics degree. I went that route, But now I'm realizing I really didn't have to go that route. I would say the majority of the people in my department do not have a nursing informatics degree. They don't even have a nursing degree, many of them. So if you're already a nurse, you already have a super advantage because they love nurses, because nurses already know the front end. They already know how the system works from the front end from a user perspective, and that's like half the battle. Now, I will say an advanced degree in nursing informatics is not a waste. I did learn a lot, and it will help me further along down the road, especially if I want to get into management or be a director of a department. But where I work, we've been hiring lots of nurses that have only worked bedside. They don't have an advanced degree, and they have been great informaticists. So what are some of the benefits of going into nursing informatics? There are several. One may be you're just burnt out on patient care. You're burnt out on being at the bedside and you want to do something new, but you still want to be involved with nursing. What you can do is come to Nursing Informatics. You still get to work with nursing all day, but you don't have to be at the bedside. You can, and actually, I work from home. I work from home doing this job, which is a great benefit. But I still work with nursing and I still work with nursing informatics, even though I'm IT now. I just don't work with actual patients. But I still feel very rewarded knowing that I'm helping patients indirectly because I'm helping nursing. I'm helping them spend more time with the patient by developing a better way for them to document where they don't have to document in the system as long as they used to. Doing things like that makes me feel very happy, and I know I'm making a difference. Another benefit of nursing informatics is that it's growing, so there's always more opportunities out there. You don't have to just work in a nursing informatics field. Like I said earlier, you could be more on the IT side. You could work as a consultant for an EHR company like Epic or Cerner and travel the world just helping new hospitals get developed with their EHR and patient care technology. So some of the careers I've seen in nursing informatics are clinical informaticists, those that work a little bit more closely with the end users. I've also seen IT analysts like myself that do more coding, they work less with the end users, and they work more with like nursing leaders or the nursing informatics department. I've seen EHR consultants that work for EHR companies like Cerner or Epic, traveling the world, helping different hospitals implement their EHR. And I've seen other informatics careers like data analysts, people that build reports, people that work with statistics for the hospital. And because this field and degree is growing so much, I've seen the need for educators to teach the online classes. So if you're burnt out from working at the bedside and you want to try something new, I highly recommend Nursing Informatics.